What is the difference between an anxiety disorder and a panic disorder?
We generally regard panic disorder as a type of anxiety disorder. In other words, we divide anxiety disorders into group or different groups. So one group is panic disorders, another group which overlaps is agoraphobia, another one is social phobia or social anxiety disorder. Traditionally, obsessive compulsive disorder has been classified as an anxiety disorder, although in the new DSM-5 it's its own disorder now, but it's still a kind of anxiety. Um, it used to be we called post-traumatic stress disorder, PTSD, an anxiety disorder, but it's now been classified as its own disorder, but anxiety is the main symptom. Agoraphobia, which is Greek for fear of the marketplace, refers to several related fears. One is fear of open spaces, another is fear of crowded places, and another which is connected is sort of fear of being by yourself. So people with agoraphobia have one or two or three of those things which overlap. And it can be confused with social anxiety disorder, also called social phobia, which is basically fear of performing in front of other people or under the scrutiny of other people. And agoraphobia and social anxiety disorder overlap, and sometimes they're essentially the same thing.
Now, when we look at um, social anxiety, which is the question, why does that happen? Well, uh, a lot of times, anytime you see anxiety, why does anxiety develop? Anxiety develops usually when you don't have the tool to cope with the situation. So, anxiety disorders can develop at a very young age, and they can continue throughout a lifetime. Usually, there's a lot of environmental enforcement to keep that anxiety disorder going. Separation anxiety is being pulled away from your parents when you're not ready to be. And they might have that when they're beginning school. Uh, you might see a lot of separation anxiety around age 6, 7, 8. Um, and you might see that even into some adulthood years if it's not been resolved in therapy primarily. There are medications for it, but again, you won't reach your medicines. Therapy is the number one way to go to help with that.
What might predispose someone to the development of an anxiety disorder?
Well, genetics clearly plays a part. A lot of people who develop an anxiety disorder, but not all, are anxious during childhood and later, or adolescence and later. Um, on the other hand, they often have an anxious parent or two, so it may be genetic or it may be learned. Um, there's some evidence that when during pregnancy, the child can be, the future child can become anxious as a result of the mother being anxious during pregnancy, and that has biological effects on the development of the child's brain in utero. Growing up in an anxious family or an environment that's conflicted with a lot of abuse or conflict or so on, that can predispose people to developing anxiety. Um, in some people, this is another way of saying it, but some people are born with an anxious temperament. So in babies, you can see some are more anxious than others. And some are fast, some are slow. Those are temperaments. The traumatic events occurring during childhood or adolescence or in adulthood can trigger anxiety.
What is the connection between OCD and anxiety disorders?
OCD is a form of anxiety disorder, although as I say, officially it's now classified in the U.S. system as its own disorder, but that's just a conceptual change. Um, OCD consists of two symptoms, basically. One is obsessions and the other is compulsions, hence the name, obsessive compulsive disorder. Obsessions are thoughts that keep recurring, um, and compulsions are activities that you have to keep doing to prevent yourself from getting into some kind of trouble that you're afraid of. So an example of an obsession might be that I have germs on my hands, and the compulsion is to keep washing my hands to keep them free of germs.
Um, there's many different levels of layers of OCD. You could be a skin picker. You could take a mosquito bite and keep picking it till it's about the size of a dime. We call those coin-sized lesions. You could have those lesions all over your body. You could be twirling your hair out, twirling your eyebrows out, and so hair twirling, skin picking, biting the nails, not just in a general way, but really biting them down to the nail beds. These are all a type of, in a small way, a self-mutilating type of OCD. There's also checking behavior where if I'm afraid I didn't turn the water faucet down, I'll turn it on and off 10 times. If I didn't feel like close the door of the office, I'll open and close it 10 times or 15 times. If I have a germaphobe component to it, afraid of germs, I'll hand wash with hot water and soap until my hands are chafed and they're bleeding. So OCD comes in all types of different forms. There also is a ruminating thought component where it feels like a 3-minute tape recording where you just can't get off a certain topic and you can't break topic and go to something else. So all these medicines are treated with what we call therapy, or some cognitive behavioral therapy, and SSRI medication, which is the serotonin selective reuptake inhibitors. They work very well, but usually you have to, in most cases, you'd have to move the dose up a little bit to get to a higher dose to get some good control of it.
How do you treat anxiety disorders?
I always divide treatment into 3 areas. One is medication, one is counseling or psychotherapy, and the other is self-help, what you can do for yourself. So in terms of medications, the commonest medication we use are the antidepressants, because antidepressants are anti-anxiety as well as antidepressants. They could have been called anti-anxiety drugs. So antidepressants are often useful, and they're useful because you can use them for long periods of time without them losing effect. They're not addictive, although some have withdrawal when you stop them. We also use the benzodiazepines. These are drugs like Valium and Ativan, or diazepam, lorazepam, clonazepam. But these are better as short-term drugs for a week or two, and then maybe used just now and then when needed for, say, a panic attack. Occasionally use certain antipsychotics in very low doses. The ones that are quite sedating can be helpful. That's the medication. In terms of the common approaches, in terms of counseling or therapy, for many people that's the main treatment, depending on sort of the nature of the anxiety and what's causing it. Psychotherapy is usually more helpful in the long term than medication. And the third group, self-help, this depends on the person, but I often recommend regular exercise like walking or swimming or running or the gym. Keeping good care of yourself physically in terms of nutrition and sleep. Doing things that keep up your self-esteem, avoiding negative people, avoiding negative thoughts.
What is generalized anxiety disorder?
Generalized anxiety disorder is, for the most part, worrying. So it's people who feel anxious most of the time, and usually that's associated with worry thoughts. You know, what if this happens? What if that happens? I should have done this, I should have done that. So they're constantly in the future or the past trying to replay what happened or anticipate what might go wrong.
Anxiety, in its own right, when we're treating anxiety alone, it needs to be treated because you can become a prisoner of your own anxiety. And it'll stop you from, again, normal social interactions, employment, relationships, all these important things in your life, where if anxiety is reduced or muted, you'll have a much easier time with all of these areas and get much more fulfillment out of life. If it's combined with depression, as we spoke about previously, it's a much more dangerous condition, and it really has to be addressed at the same time with the depression.